I'm going to have them come up and introduce themselves first. Carrie will be first, and she can tell you who she is.
Hi, I'm Carrie Shotwell. I'm an occupational therapist at Cincinnati Children's.
My name is Faye Dilgen. I'm a physical therapist at the Hospital for Joint Diseases, which is part of NYU in Manhattan. But my expertise is actually in treating dancers. I'm here today because my 10-year-old son, John Hudson, has RDEB. So I have experience with PT and EB of one sample size. But I'm happy to give my experience anyway.
Hello everybody, my name is Marita Black. I'm a physical therapist and I work at Morgan Stanley Children's Hospital. I've been the primary physical therapist at our EB clinic there for just about a little over 3 years. And I'm very excited to be here.
Hi, my name is Susan Maxomsky. I'm an occupational therapist. I work at New York Presbyterian Hospital. I've been there 15 years. I'm also a certified hand therapist, and I've been involved in the EB clinic for probably about 5 years now. And I've had some experience, with splinting as well as wrapping, different techniques for the hand especially. So that's really where my area of specialty is. Thank you.
My name is John Smith. I'm an occupational therapist. Presently, I work at Mount Sinai Hospital. However, I worked at Columbia Presbyterian New York, the Choney Hospital for 10 years. I started my work with epidermolysis bullosa in the NICU when I was at Columbia, and then I also worked with it in the clinic. And then I went on to do home care for a number of years with a number of patients.
And I'm Christy Steinall. I'm a physical therapist at Cincinnati Children's. I've worked with the EB kids for probably 15 years now. I started off first doing outpatient care, and I had a patient who was inpatient that I covered for his Whirlpool treatments. At the time, they were not sedated. And then I've worked with kids doing sedated Whirlpools and non-sedated Whirlpools, and now I'm in the NICU. And I've been in clinic since we've been in existence. Okay? We're here to take any questions that you all might have, so feel free to raise your hand and let us know what you would like to know, and I'll direct you to our panel. Yes. The question is, how would you address AFOs with EB? Marita?
Hi. It's probably a hard question for me to answer because I don't know your child. But so the first thing is you want to definitely, be working with a physical therapist. You can get a custom molded AFOs. If it's something that, if your child is not walking, just starting to walk, depending on sort of how much support he needs, it sort of depends. If it's a child who's been walking for a long time but just having some balance problems, then you want to work with the orthotist and the physical therapist and make sure that they're custom molded. I don't know if I would get anything just off the shelf. There are some brands that are like a fit for all. You want to make sure that they're custom molded, that they fit the child appropriately. And then develop a very slow wearing schedule to make sure that they work. The biggest thing that we see at our hospital is that parents say, oh, well, they don't work, so we just, they're sitting on the shelf somewhere. I do encourage you to make sure if they're not working for your child, then please visit the orthotist that made these, that created them, and and talk to the physical therapist and try to get them adjusted. Try to sometimes orthotists can just make them slimmer, shorten pieces, and make them more comfortable so that they work. Because if you're not able to, if your child's not even able to wear them at all, then they're not going to be successful.
And there are some places who will go back and work on them, like Cascade will work with a therapist. So when you get them for them, since they are custom made, make sure you pad, like you have to be padding and wrapping the same pretty much, so that you give enough space. You might have to wear 2 socks someday or things like that. But do follow up with your therapist and orthotist, like she said. Other questions? The question is, are there any specific oils that you can use on the hands to help soften them up? So, because of the
Right.
scar tissue.
I think the best thing to do for scar management for most patients is actually scar massage followed by active movement. The problem is sometimes actual friction can create more problems for you. So there are certain techniques I would be more, careful or cautious of when you're actually doing manual techniques. Pretty much any type of lotion would be successful. It's providing a little bit more friction, which is why you're not getting direct skin-on-skin contact, where it can get stuck and cause more blistering. I think it's a personal preference. If there's certain lotions or oils that people are using, feel free to share that, but I think it doesn't really make a difference as long as you have some kind of barrier to provide that friction instead of the shearing force on the skin.
Anybody else? Okay, her main question is, she has a pointed foot similar like a ballerina. We in physical therapy call it plantar flexion, and she basically has a contracture. She's been working with a physical therapist to try to get her foot back up into neutral or into dorsiflex position, and she's wondering what she can do or what we think her prognosis or would be for that. Marita?
Again, it's hard because I'm only seeing you from afar, but have the exercises thus far, have you gained any range of motion?
A little bit.
A little bit.
I've been able to get.
Right. Susan's going to help with the splinting aspect. Hold on.
Well, the first thing is you have to find out if your foot, the joint is actually contracted. So if the foot is contracted, meaning that you're not getting, if it feels very hard and you're not getting ability to stretch, then the chances are you may not get back to where you were. If there is some give, then what you would want to do is have the therapist work on a progressive splint for you. So you would have to go at a very slow rate. You would start trying to bring that foot back a little bit at a time and then keep going back for revisions and hope that the skin is stretching and that the joint is moving as well with it. And so if that's the case, then you might get some improved range of motion. If the joint's not really that functional and it's really kind of stuck, there might not be as much success.
But if you're looking for a specific splint, I would ask the physical therapist, about the splint, but to recommend an orthotist that the therapist works with that could help mold something to your foot to at least maintain the range of motion that you have currently.
First one was basically back to the scar massage. I'm just wondering how much, you were talking about applying pressure and over scar. Normally when we're doing scar massage, it's very aggressive. And how do you know how much pressure to apply? Is it just the experience with that patient or, yeah?
The problem is that sometimes scar tissue can go very deep, and sometimes that can be the cause of where the adhesion is. You really want to start very superficial, and you want to go multi-directional. So you don't really want to go in just one position. You want to go circular, clockwise, counterclockwise, left and right, up and down. And you don't want to be doing it more than 5 minutes at a time, specifically in one area. The problem is when you're doing scar massage, it actually increases the blood flow to an area, and so it will heat the tissue, and if you overdo it, then that blood is just sitting there. It's pooling and doesn't have enough ability to cool itself, and you don't want to have additional tissue damage. So I would be very cautious as you do scar massage. It's not something that you do very aggressively. You start off very minimally and then build upon it based on any symptoms that might occur after.
My son Jonah has an eating aversion. I think early on it came, I don't know, are you occupational or some of you feeding? Okay, so early on he had really bad reflux and he basically threw up his entire life, and so I think most of his stuff now is probably psychological. Like he has weekly feeding therapy and he doesn't seem to have a lot of physical reasons why he can't eat. He has really small teeth and stuff like that, but mostly I think it's up here. I guess my main question is so he qualified for early intervention services, and then he turned 3, and then he was evaluated by the school system. We live in North Carolina, and he has like a 36% physical delay, just up and down stairs, and nothing. He can walk. I mean, he does really good. But my argument is he needs to be qualified as special needs because he can't eat. And they are saying he is not, in fact, special needs as an EB child. He does not qualify for any special needs services. So, like, short of getting a lawyer and stuff, I don't really know. Like, when he gets to kindergarten, they say he'll qualify for a 504. But until then, they're like, deal with it, essentially. So
It's really tricky when you get into the school district. I know in Ohio, and it's a little different from state to state. In Ohio, you have to be 2 standard deviations below the typical mean to qualify for school services, and that's because it's funded by the state. So if his problems aren't directly impacting his performance at school and he's not considered to be 2 standard deviations below that mean, he's not going to qualify for services. But that's where you have, Cincinnati, we're so lucky to have the institution that we have, and that's where a lot of the kids will come to the outpatient therapy model to address things like feeding, because in the schools, it's just not typically there. And I will say that as a therapist who has worked with many kids with feeding disorders, the school therapy typically isn't going to cover what you need. So I would highly encourage you to look around what's in your area, try and find somebody who's an experienced feeder, either a speech therapist or an occupational therapist, and go there. Additionally, if he is in any amount of pain while he's eating, though, it's going to be really, really hard to move forward.
I mean, he has a therapist right now that comes to our house, but I guess I'm thinking more like if I want him to be able to go to preschool or anything like that, like what does his school day look like? We have like a special needs school, but they won't take him, who have nurses and physical therapists and occupational therapists on staff, but, he's a typical child. Right.
I know. It's
Do
so
you note
tricky.
my sarcasm?
I know. It's so tricky, and it's really hard.
If you could network with other parents or get information on what your specific, rules are, because you could also, even if you're not in the school that's, special needs school, you certainly could get, services either after school or in other places, and still have it. In New York, you can still have it paid by the state. So often people do go to arbitration, but I do think it's a great idea. Really finding out within your community who the good therapists are. You can have, it's really the luck of the draw often in early intervention or in any of the therapies. If how experienced the therapist is, I would try and find out from your service providers or the doctors who has worked with EB, or I'm always impressed by all you mothers as I love that all the doctors have acknowledged that we learned from you. But communicate with other mothers in your area. Do you have anything to say to this?
I could probably just address the part about your question about the schedule, and because I think that's a big concern when the children are young. So again, as my sample of one, because my son was in preschool part-time, he received services at home for PT, OT, and speech, and that included feeding therapy. So those were appointments made in the house outside of his preschool schedule. And once he got to kindergarten, the services were provided in the school. And in that situation, when the child reaches that age, that's one way to shut me up. Okay. They're usually pulled out of class, and so he might miss math, science, whatever else is going on while the other kids are in school, and that's typically the way school-based therapy works. They are pulled out, and PT might be twice a week for 30 minutes, speech twice a week, OT, etc.
Certainly, as a tax-paying citizen, you're entitled to services. And these things are often funded on a number of levels, both federal, state, city. So it really does vary, but certainly I believe you would be.
And her question was, what if I decide to homeschool? In case you didn't hear that.
I was just going to add, even in states, it can vary between districts. So, we have parents.
I think ours is notorious.
Yeah. We have parents that will specifically move into a particular district because of the therapy services that are offered there. So that's another thing to explore.
Other questions?
Yes.
This is my grandson, Steven, next to me. And Steven has braces that he wears. He's supposed to wear them every day. And since he's gone into a growth spurt, he really doesn't want to wear them because it's bothering him to do it to stretch. So my question is there any kind of oils or vitamins or something holistic that we can give him, maybe prior or constantly, to help the joint be a little bit more flexible and movable?
I think it's kind of, again, more of a personal preference. I think lotion, if you are going to be doing range, I mean, we all recommend, I think, stretching, range of motion, preferably on a daily basis if you can. But anything to help lubricate the skin, so that you're avoiding that friction. But I would ask around to some of the other parents that are here as far as what their preferences are.
I think the main thing is to keep doing the range of motion. Move his foot as much as you can in all directions, up and down, and do circles. And he needs to do it himself as much as he can. And because it's the joint sometimes, it's not just the skin. It gets tight. And if his orthotics aren't fitting him anymore, then get him back into the PT or the orthotist, wherever they came from, or a new person, and have them refitted. Have him new ones, because they can get them every year. Is that right? Anybody know of any meds?
No, I don't. But I just wanted to speak to if he's having a growth spurt and he's developing, he's probably changing in personality, becoming more independent. And often families with any long-term therapies, things become behavioral with the children, totally understandably. So maybe there are some strategies you could use for, elongating his toleration of wearing the splints, some kind of reward system, watching a show or whatever, or negotiating more. I'm sorry? Yeah, playing with his iPad. I've heard that he's a lover of the iPad. But some kind of things as children change over time, especially the early years, and that they want often more control. So.
Hi, I'm one of Stephen's nurses, and we were issued the braces when we had a very long stay at Morgan Stanley last summer. Well, my question is, he's much more compliant to doing his stretching if we don't do the techniques of using our hands on top of his knee and behind his ankle and all that. If we let him lay on his back and just stretch out the best he can and kind of do a little moving around and then apply the braces for whether it's an hour or 2 hours, however long, is that acceptable? And we do have a reward system, so we just haven't gotten him anything quite yet. He gets stuff every day, so.
I mean, I think that if he's, I don't know what you mean rolling around, but if he's, right. And then working at his feet as well, his ankles, or, yeah. Oh, the knees. Yeah, I mean, it sounds like the fact that he's wearing, you said he'll wear them for about several hours. I think that's really great as well. I mean, I think if he can do the most work on his own, then that's probably going to be what's most helpful. Yeah.
Other questions?
Hi, my name is Carly. I am a physical therapist with Phoenix Children's Hospital. My experience with skin diseases is mostly with burns. So I'm new to the EB world, now involved with the EB clinic that we have with the dermatologist, occupational therapist. It's a new growing clinic that we're really excited about. However, my idea is with burns, and I know it's a completely different entity. So within the clinics, over the last year, I've played more of a passive role because I don't really know my role with stretching or how to educate patients. However, I'm learning a lot today. So my question is, and it does relate to burns because this is what I did with my kids who had skin grafts or partial thickness burns. What is your experience with using Coban with elastomer inserts or without for web spacing for the toes and the feet? Do you find it effective? Are you familiar with Coban and the elastomer, and also using silicone lining within the Coban? I have so many more questions too, but I'm going to leave it to that one and probably pick your brains later. Thanks.
I think that using a silicone-based either elastomer or autoform is very appropriate because it's a soft texture and it will conform nicely to whatever hand that you're working with. Coban I would be a little bit cautious of just based on applying too much compression over an area and possibly causing a little bit more of the skin breakdown. What would be very effective would be using the silicone-based putty in addition to thermoplastic material. So you can use Velcro behind the thermoplastic material and let it mold directly into that as you're molding either a C-bar to open up the web space or making a resting hand splint or whatever type of splint that you're going to utilize. Does anyone else like to add?
I think it depends on the kid and their skin. I know my son would never tolerate that, and especially if there's wounds on the hand or between the fingers, I can't imagine putting Coban and getting the dressing to stay placed under the Coban. So once the Coban slips, if it moves, if they're using their hands a lot, it moves, and then you're creating wounds because it's causing friction between the digits. So it might depend on the child and how tough their skin is and whether or not they could tolerate that, and if you need a dressing under it and whether the dressing stays in place. That would be my thought.
What she's saying, would you be able to use like some Tubifast or just even the conform and stuff to secure it rather than using that wrap? Because she may not be talking about Coban. It may be something else.
We typically recommend just using the child's bandages, like whichever they're using for their dressing. If you feel like you want a little bit of extra padding, you could try using some of like the thicker dressings underneath there. And there actually is a website that I had written down to bring with me today that I forgot, but you can email us. It's on Stanford University's website, actually has a video of how to wrap a hand, and they go through and they show you how. So I think it's a great educational piece, and I often refer it to families if they have questions. So. Okay.
Sorry, I'm asking this for a friend, so I don't know if I have the question entirely clear, but she was saying that she sees that her son's feet are turning in to the sides like this, but when he has been seen, they say that the bones are not affected at all, but she's wondering if she's seeing them turning in, and she's wondering if there's anything that she should do as a preventative measure. Also, I don't think she has as much access to OT or PT just because she's coming from Mexico. So are there exercises she can do? Yeah, he's not walking yet. He's just learning to walk. He's almost a year. So yeah, when he's walking, she sees his feet really turned in. That may also have something to do with his age, even, I don't know. But she's just wondering if there are exercises or anything that she should try.
He's one.
He's 11 months.
11 months. So you could try to gently move the foot in the opposite direction that I don't know, I think she's saying like this. Yeah, so just try to gently move his foot. Right, so you want to do it gently. The best thing to do is usually put him on your lap, be reading a story, or keep a toy that it's like his favorite toy to play with. And during that time, you can gently stretch his foot, trying to move in the opposite direction as possible without him, really screaming, crying, because you don't want to hurt him either.
I do that, but when he began walking, he does like this. But when he sit, I put his feet like this, and he's like, mm-hmm. But when he began walking, he do like, like no.
So it could also be coming from his hips as well. I don't know, are his knees pointed inward as well? So you could gently also work on just sitting in a long sitting position with the knees pointed gently up to the ceiling. You could do it on the floor with him and have him sit in between you when you're playing with him, and have him practice sitting in this position basically, and see if that can help to give him a little bit of a stretch in the hips. And also someone, Faye had mentioned, has he seen an orthopedic doctor? That would be an option too, because there might be something else going on. I don't know if necessarily that's from the EB, what you're describing. I'm not sure.
Sorry, I just wanted to say I'm from Shriners Hospitals for Children in Galveston. We're actually starting to work with EB patients, and we do a lot of stuff in the valley, across the border in Mexico and the U.S. So I was just going to say I wanted to get your contact information after this is over, and we can talk to our care coordinators about arranging some, rehab and just regular consultations.
I also wanted to add to, children learn best through play. So while sometimes I think it does look like therapists are playing with your child, they usually do. We are playing with them, but we do have a goal in mind while we're playing. And I would encourage you to ask your therapist questions. They should be explaining that to you. But you definitely are able to ask them, like, what are you working on right now? And they should be able to tell you.
We're in the process of adopting a toddler who has EB over in China, and so the amount of information that we have on him is fairly limited, but we suspect his case is mild to moderate. But one of the issues that we noticed that he was facing, in his first medical report, he was born with what would look like club feet, and then by the time he was 2 weeks, they said that his feet had completely straightened out, and so they suspected that it was just his positioning in utero prior to birth. But we recently got more updated photos. We got photos from when he was 13 months, and then more updated photos recently, and he's 2.5 now, and his right foot looks more pointed inwards in each set of photos, but the medical reports that accompany it say that they're perfectly fine. So my question is that, we kind of received this checklist of when he comes back stateside, order a CBC and an ABC and a whatever else kind of test. And my experience with pediatric orthopedic specialists is that it's difficult to get their attention at such a young age, because they're like, oh, kids, they're so flexible, they will, they'll grow out of it, come back and see us when he's 5 or whatever. So are there specific tests that I can request get done along with the ABC XYZ in the field of orthopedics so that I can push it for, I don't know if there's any kind of standardized, hey, ask for this, I don't know what this is, and maybe this doesn't exist. Does that make any sense at all? Okay.
Is the child walking?
He is, technically. We don't know to what extent, and it just looks, I don't know, okay, I'm gonna cry. It looks like he's not played with a lot. I mean, he's in an orphanage,
Right,
so
right.
and he's a special needs child in a normal orphanage, and so just limited resources. I'm not sure how much physical activity he's getting, and they never have him in shoes, but they've got outdoor areas, and they very much emphasize that they do outdoor play with the kids. But I'm going, well, they're probably not letting him outside play on the gravel, playground with EB in socks. So I don't know. There's a lot of unknowns, and in the preparation process, I'd like to be able to know what I can do and who I can start talking to, or what I can be armed with, so that when the time comes, we can push things forward rather than having to start the fight then.
Right. It's a big question. I think that, congratulations, by the way. I think that when you see when you see your child, I think that some of these questions it will be easier for you to make that determination.
Okay.
And then, I think it depends, because once he's walking, and you see his foot moving, and the pediatrician sees him, and it may not be, oh wait, let's get an automatic referral to see the orthopedic doctor, and also if you are concerned when you see the child at that point, children of all different, lots of children have different, they might walk funny, especially when they're younger or if they're walking later. And then sometimes they do sort of grow out of these things eventually. But, you can get evaluation from a physical therapist as well, just to see if there's any lack of range of motion in the joints of the ankle or the hip, to see if that's maybe what's causing the problem.
So I can request an evaluation from a physical therapist without having.
Oh.
I can request an evaluation from a physical therapist without having to go through somebody like an orthopedic specialist who typically refers.
Your
out.
your pediatrician can definitely give you a prescription to see a physical therapist.
Okay.
There is, direct access is coming and has come. I don't know what state you live in.
DC.
I'm not sure about DC, but some states you are allowed to see a physical therapist without going to a doctor first, but typically insurances nowadays still want you to go see. But yeah, you can just go to your pediatrician. That's something, the first appointment that you have, you're probably going to be going over a lot of stuff, but you can definitely ask them at that time if you're concerned about the way your child's walking or moving, getting up from the floor. You can ask for a prescription for physical therapy.
Depending on how they do adoptions in the DC area too. I know in Cincinnati we have an international adoption clinic that, nothing like that.
I just wanted to add that sometimes you have to be careful too where the blisters are, because that might be causing more compensation in the way that they're walking or they're moving in terms of just day-to-day mobility. So you just have to be aware that maybe some days they might be walking normal per se, and other days they might show that they're either, having like a little limp or they're not weight bearing fully on their whole foot. So it's just something to take note of in terms of when you're going to see either the doctor or the therapist, to say, I'm seeing it consistently, or it only happens when I see a blister or when he's weight bearing over on this part of his foot.
Okay, my question is a physical therapy question. So my son, when he was about 8 years old, he's 15 now, but when he was about 8, he was standing on the edge of the pool, and I noticed that his leg went down like this, and then his ankle went in, and then his foot. And so both of us do it. His ankles go in, and I don't know if that's an EB thing, okay, so okay, great. It's an ED thing. So my question is, as he's gotten older, he's 15 now, and he's my man-child. He's big, and he can walk, but he's having a harder time walking longer distance. Like to walk here to the room, it would be hard for him. So my question is, and then his back starts to hurt. So obviously it's from placing his weight in different places depending on where he has blisters on his feet that day. But I'm just worried now about his ankles that go in.
You want me to talk? I don't really know where to start. I find with my son as well that as the distances are longer and he has to work farther, that his feet do hurt more and he has more trouble. He has one foot that tends to turn in more as well.
His feet don't turn in, his ankle bones.
Right,
Yeah.
like he has maybe like pronation.
Sometimes what you're seeing there, the ankle is compensation for a tight calf and a tight Achilles. If they don't have the range of motion to what we call dorsiflex their foot all the way up, you'll start to pronate and roll your foot in. It's a normal way your body says, I can't do it this way, so I'm going to do it that way. But does he have a PT at home?
No, I've never really, I just saw this I thought, I'll come to this class. And now I'm like, maybe I should ask about that.
Well,
so no, I haven't thought
it might be interesting to have a therapist, just a good orthopedic physical therapist who's good with manual skills. I always say, doesn't have to be somebody who knows anything about EB. You just have to want to learn, and you have to be bright and caring, and then you can treat anything. So if you think they have the right mindset to just do a general strength, flexibility, balance, range of motion exam on him, they might be able to suss out if there's a strength issue, a tightness, or if it's the joint itself. Even with bandages on, you can sometimes assess the mobility of the joint, and they'll let you know what the actual range of motion at the ankle is, and then whether he might benefit from an orthotic or something in his slipper or shoe, whatever, to get him out of that position.
I just wanted to add too that if he's having a lot of back pain, it's probably because he has very weak abdominals. So sometimes just a generalized strengthening of his trunk would be very helpful, and also maybe then change his balance in the way that he's ambulating, giving force through his ankle. So it's another thing to consider as well.
Hi. During the school year, my daughter has a clubbed foot. During the school year, she uses shoes more often, 8 hours a day. So she walks pretty well. But during the summer, when she's not wearing her shoes as often, I notice that she starts limping more than usual. Should I just enforce her to use her sneakers in the house? I want her to be comfortable over the summer, and I don't want her to feel like she needs to have her shoes on or whatnot. So I'm not sure if I should just allow her to use her shoes during the summer months.
How old?
9.5.
9.5. The shoes that are recommended for children with EB, or that are sort of out there as recommendations for children with EB, tend to be like extra cushiony, and so if she is limping, if you notice her limping more, then I would say that you should enforce her wearing her shoes a little bit more. I mean, it's a hard balance. She's sort of at that age that she doesn't maybe know what's good for her and what's not, and what's not.
Back and not want to wear them,
Yeah.
Does she have a PT? Do you have a PT?
She doesn't have a PT. We've done the OT-PT on her, and they told, the school has done it, and she doesn't really have a set one, but.
Because she may need strengthening, because she may be collapsing too, without having the orthotic in her shoe. So that could be part of it. Yeah, we have, at least from the EB Cincinnati clinics, I have a list of them. I'll have to email them to you because I did make copies, but grab me at the end.
My question is, when do you guys determine that surgery would be the right measure to take? For feet. Talking about the same daughter, she was born with the foot inward, and she's going to be 10 now, and it's still inward. But sometimes she can force it the right way and walk straight. But most of the time, it's just like she naturally bends it inward. So, I just want to hear your thoughts on when do you think surgery might be an option.
Is she walking?
Yes. No
so
surgery?
I would, we don't, it's really the surgeon's recommendations, but if your child is functional and is able to walk and do things that they like and enjoy doing, I personally would postpone surgery as long as possible.
Go to the orthopedic doctor, see what they have to say. Okay. But she's absolutely right on, she has function. You do surgery, you're going to have time where they're not going to be able to walk on it. You could lose function, you can have more scar tissue.
Last question.
I just wanted general references or resources for physical therapists and occupational therapists for treating EB patients. Do you guys have any? I did a couple searches and I didn't find very much.
There's little research.
It's important is what I got, but I didn't get very much else.
We look at Cincinnati.
I think kind of the theme is that the parents know best, so when you don't know the child, you really need to find out where the biggest blisters are and where the real source of potential harm could be. So really getting a full history from them is significant. I think the key goals is really just trying to make sure you're maintaining range of motion at all joints as much as possible, and trying to make it as fun, because a lot of times the kids are going to so many appointments that are not fun. So you really want to try to engage play and incorporate that into, your therapy as much as possible. Some of the things that you want to recommend are softer type surfaces. So usually you can use, basic mats with kids or balls or bolsters, but sometimes you just have to be a little bit more cautious. Maybe put some kind of barrier there so that there's not as much friction, like using a sheet or towels or something like that. But basically you could do pretty much anything else within the parameters of their pain or where there could be potential harm in creating either increased blisters or opening up a blister.
The other thing that parents can do for the therapist is you do dressing changes. When you have a therapy appointment the next time after your dressing change, take pictures of where those blisters are or where the sores are, where things are, so that then you can show the therapist and then they'll know where to hold and where not to hold. Because there's nothing worse than trying to do a stretch on a patient and they've got a blister right there, and so all you're doing is causing more pain than they really need to have. So if you can take pictures, because lots of us have cameras on our phone, and you can delete them, it will help the therapist out. And it'll probably help your dermatologist too.
Also, just want to emphasize weight-bearing activities as much as possible, arms and legs.
Yeah, it's important for bone density so that they have good bone growth and don't get osteoporotic early. Any other questions? Okay, one last question, and we get to go on a break, I believe. You can make that up.
All right. Just what we were just talking now. My son is 15. He has recessive dystrophic. He was walking fairly good until he was 8, and then he's been less and less. He's had a lot of issues with his feet, a lot of blisters in his ankles, and now he's in a wheelchair. He used to be able to walk okay. I never allowed the wheelchair in the house. You have to walk to the bathroom, that kind of thing. And he's always been able to do that. And the doctor was afraid of this bone density issue. He's not walking enough, his bone density. We tried different things. We tried to give him extra vitamin D and calcium and all of that. And that increased the quality of the bone, but not the density of the bone. It's just getting more osteoporosis, like you were saying. Now, we tried to get him to walk more, and we just proceeded in destroying his feet. And then he didn't walk for 3 months. And so he's now starting to walk again a little bit. I have to help him. Now, is there any exercises that he can do that don't involve walking so much to increase his bone density? That's my question.
What about just just standing exercises too? Instead of making your child, walk across the room, even just getting your child to stand, for longer periods of time. Get them to stand, at the bathroom mirror while they're brushing their teeth, like simple just activities during their everyday life that you would typically stand, maybe have them stand as much as just standing. I mean, I don't know if that will necessarily, but if he enjoyed it.
Swimming is not a weight-bearing sport or an activity, so you have to do land-based. And like she said, the intermittent standing is better than no standing at all.
Thank you very much.